We're on the eve of strike action. Lots of our viewers are going to be very worried about the impact. So we've heard about some A&E departments even closing because of it. How concerned are you?
Very. I mean, we've got to a point now where strikes in the NHS have seen more than 1 million appointments, operations, procedures delayed, cancelled, rearranged, great inconvenience to patients who are already waiting far too long for treatment. And this has cost us more than £1 billion. So it's the worst of all worlds. We are paying a heavy price for the government's failure to negotiate an outcome to this dispute, a fair outcome, and also the mishandling of the whole picture of industrial action overall. Let's cast our minds back last year when the nurses, this time last year, offered to call off strike action before a single strike could take place if only the government negotiated. They refused. The nurses went back on strike. It was really difficult to get them back. And they didn't learn from that, so we ended up in the same position with the junior doctors. They then settled with the consultants at a higher percentage increase than they did with the nurses, which has caused real insult to nurses. And there's still no end in sight with junior doctors. And I'm sure this is in part due to the fact that in the last 2 years that I've been Shadow Health and Social Care Secretary, we've had 5 Conservative Secretaries of State. I don't think that's serious. I don't think it's professional or competent. And I think the tone that Victoria Atkins's predecessors adopted with the staff in terms of those negotiations, the refusal to negotiate at all, I think it set them off on the wrong course. And you know, there's a reason we didn't have national strikes in the NHS when we were last in government. It's because we treated the staff with respect. We had the economy growing so we could invest in the NHS.
Well, let's talk about what you would do, because you're the guy who wants to be in control of the NHS. You want to be the Health Secretary after the next election. Would you agree to the demands of the junior doctors? I've
been honest with the junior doctors that a 35% pay increase is not something, given the state that the Conservatives have left the public finances in, that I would be able to deliver. And the way I see it, the staff are making
strikes, then,
what we
you?
haven't. No, no, I don't think that's necessarily the case. I think with any negotiation, there's give and take. I think they would understand the constraints we're operating under. And what I've said is that the fundamental point they're making, that pay hasn't kept up in line with inflation, is a fair argument. But what I'm saying is to get us back to where we should rather than an event, and we're going to have to try and negotiate a compromise and a route out of this misery for staff.
Would you give junior doctors a bigger pay rise than nurses?
Look, I want to look at pay in the round, and I've said, you know, obviously not going to pluck figures out the air or do negotiations on air, but no, but I think it's a fair challenge to ask about the overall approach, and I think consultants would understand when I say, without any offence intended to them, the people I'm most worried about in the NHS at the moment are some of the lower paid staff who are really feeling the pinch with the cost of living crisis and feeling the pain. We've got staff going to food banks. So the lower paid staff would be my priority, and we'll do as much as we can, as fast as we can, but recognising that there are those constraints on the public finances. And that's why I'm being absolutely determined, along with Keir and Rachel, to make sure that we don't make promises that we can't keep. I don't want to say something to junior... I mean, it's the easiest thing in the world for me in opposition, say, don't worry, junior doctors, 35%, no problem.
I'll be coming back to you when you're Health Secretary.
And then break the promise to them after the election. We're not prepared to do that. So we are willing to negotiate, and we recognise that their pay hasn't kept up in line with inflation. We recognise the contribution they make to the National Health Service. But you're not doing what they want, though. That's the crux of it, isn't it? You're going to say, we're not going to do what you want. You're asking for too much money. But we'd be willing to negotiate, and also to look at a willingness to look at a whole range of issues beyond pay, but the wider terms and conditions that the staff are operating under.
Oh, come on, that's what lots of public sector workers get really frustrated about when the government says that, don't they? They say, oh, they're talking about all these different things, but we're worried about money.
And I can understand why particularly some of the lower paid staff in the NHS are worried about money. We will do as much as we can, as fast as we can, but we've got to recognise that the Conservatives have done real damage to our economy and to the public finances, and that makes the job of an incoming Labour government after the election, should we win, much more challenging than it was in 1997.
It's interesting. I want to talk to you about that because it feels to me like, look, the NHS is at a critical moment right now. You are the guy who wants to be entrusted to run the NHS after the next election. So I want to talk a little bit about what your vision is. I know you've got a dentistry rescue plan, you've called it, that you want to talk about today. What's that? Well,
I mean, we've seen from really stark research from the Nuffield Trust that NHS dentistry is on the brink of collapse. We see huge parts of our country that lack any access to NHS dentistry at all. DIY dentistry, people literally pulling their own teeth out, is on the rise. And tooth decay is the #1 cause of hospital admission amongst children aged between 6 and 10. Now, as with the rest of the NHS, it's going to take time to get dentistry back to where we want it to be. But we're going to start with a dentistry rescue package. That's 700,000 appointments a year in the NHS for dental patients, alongside recruitment incentives to those areas that are worst off. I mean, you look at the northeast of England, the southwest of England, absolute mess there. And we'll also introduce a supervised toothbrushing programme for children aged between 3 to 5, because one of the big shifts we need in the NHS is a shift from not simply treating sickness but preventing it in the first place. And this is a tried and tested and fairly cheap, actually, measure that would keep children not just with clean teeth but out of hospital.
It's interesting you talked there about it being fairly cheap, and you, at the beginning of the interview, were very clear to say, look, there's not going to be that much money to go around. Does the NHS need more money?
Well, we've made some big commitments, £1.6 billion by abolishing the non-dom tax status for the NHS, which funds 2 million more appointments a year to cut the backlog, double the number of diagnostic scanners in addition to the dentistry rescue package, and just shy of a billion. But the case I've been making is it's not just that the public finances are constrained, and that ties our hands to an extent. It's also that we can't just keep on pouring ever-increasing amounts of taxpayers' money into a model that isn't currently working. So, for example, despite the fact that GPs are providing more than 1 million appointments now than they were before the pandemic, and despite there being 2,000 fewer GPs than there were before, people struggle to get a GP. That means that instead of costing 40 quid to see that patient, they end up in A&E, which costs £400. So not all of the answers to the NHS challenges are more money. It's about spending the money that we already have going into the system more effectively. And that's why I keep on emphasising that investment, important, of course, but so is reform. And if you don't reform the NHS, it's not going to be there for us in the future.
It's interesting because it feels to me like you are someone who is willing to say what I guess some people might describe as kind of hard truths about the NHS. You've run in with GPs a bit before. You've described them as GP leaders as blocking progress. I mean, do you see GPs as, like, vested interests when it comes to the NHS?
No, I actually see them as critical to the future of the NHS. We need more GPs. We need more activity in the primary care system, and that's GPs working alongside a whole range of other professionals. And we've got a big commitment to trial new neighbourhood health centres along the same lines as Australia, where I was just a couple of weeks ago, looking at their model. I do run up against sometimes opposition to reform in the NHS, and I think one of the things I've seen change over the last couple of years as Shadow Health Secretary, when I started out and emphasising reform...
Who's opposing? You say you run up into opposition. Who from?
Well, I think that there are people who sometimes hear the word reform and think, oh, God, like, is this going to be another top-down reorganisation? Is this going to be privatised?
Who work in the health service?
I think people in parts of the health service, also sometimes general public, sometimes hear reform and they worry that it means privatisation. And I'm really clear about that. I don't want to see the NHS privatised. I want to defend an NHS that is free at the point of use. In order to do that, we need to modernise. And what I've been learning from in the last couple of years are some areas of outstanding practice in the NHS, but it's also exceptional practice. And I've got what my challenge will be if we win the election is to take the best of the NHS to the rest of the NHS and also learn from other countries in terms of how they are designing and delivering healthcare, because there's so much to learn from around the world. And having spent time looking at continental European countries, looking recently at Singapore and Australia, it's not the model of funding that needs to change in terms of the free at the point of use publicly funded service. It's the model of care. And when I ask the fundamental questions, why is it the NHS isn't the envy of the world? Why are our outcomes so much worse? And it's because we run pretty much top of the table for spending in hospitals, but you look at primary care, community services, mental health, diagnostics, we're either near the bottom, at the bottom, or seriously lagging behind. And that's why reform, I think, is even more important than investment.
We've been talking today on a separate issue about trans guidance for schools, which includes preserving single-sex spaces like toilets and changing rooms. What do you think policy should be in the NHS? When it comes to single-sex wards, for example, should a trans person be in a ward determined by their gender or by their sex?
Well, it's a good question. Actually, the NHS, I think, handles this very well as it is. And we need to make sure that single-sex spaces are protected in the NHS and that there is inclusive healthcare for trans patients, and most hospitals work this very well. What I was...
so how do those two things... Just spell it out to me then. You think single-sex spaces should be protected, so that should be based on your sex rather than your gender.
And trans people also need spaces where they are safe, respected for who they are, and feel comfortable. And one of the things that's really angered me about the government's handling of this whole issue of gender identity and trans rights is they've sought to take challenges and problems and exploit them rather than solve them. So, for example, Steve Barclay, the previous Health Secretary, it was his big thing in his conference speech, despite the fact we've got record high waiting lists, he sort of sought to stoke this culture war. And my worry, I sat there listening to what he was saying, thinking, well, I don't fundamentally disagree about the importance of sex-based wards in the NHS. But if you're a trans person listening to this speech, I'd be thinking, OK, but then what about me? What if I'm going into hospital next week? And I want people in our country to feel safe and included and welcome. And I think the way the government have sought to divide our country with these culture wars is ugly and divisive and unnecessary. And I think we've got to work together across the political divide. And on the, this thorny issue of sex-based rights versus gender identity, I think with a lot more goodwill and a much more respectful conversation, we can find a way through that maybe not everyone loves, but everyone can live with. We've been here before on equal marriage, for example, where there was a big clash on sexual orientation versus people's religious freedoms. We found, we solved that problem by working together and doing it respectfully, and I want the government to adopt more of that respectful tone, but I won't hold my breath in the run-up to the general election.
I've got one more question that I do want to ask you before I need to let you go, and it's about Labour's position on Israel. The Labour Muslim Network has written to Keir Starmer asking him to cut ties with Israel's ambassador to the UK. It's after she did an interview on Sky News saying that after the conflict's ended, Israel wouldn't accept a two-state solution. Should Keir Starmer cut ties with the ambassador?
Well, firstly, I think that's an appalling position for the Israeli government to take. There is no future and no peaceful future for Israelis or Palestinians that does not involve the creation of an independent Palestinian state. Palestinians deserve that same right to freedom and self-determination as Israelis, and I think the creation of that Palestinian state is essential to Israel's long-term security too. So I was appalled by what the ambassador said and what other leading members of Israel's government have said, and I think it calls into question Israel's broader strategy around the war and its war aims, alongside the disproportionate civilian casualties we've seen and the devastation it's wreaked on innocent people, including many children in Gaza. Okay. Where I would disagree with the statement from Labour members is we've got to engage with people. And we've got to make that case to the government of Israel. And so I wouldn't cut ties or stop talking to the ambassador. It's important we talk more, actually. But I absolutely condemn the one-state solution approach.
OK, thank you very much indeed. Wes Streeting.